The majority of our patients, they are symptomatic when we scan them. About 70 to 80% of them are symptomatic. Some of the symptoms that they can experience is recurrent swelling of the lower calf and ankle, maybe some heaviness, burning, itching in their legs. Patients can have spider veins or reticular veins. The spider veins are very small. They're less than 1 millimeter in diameter. The reticular veins are a little bit more larger, between 1 and 4 millimeters, and you can feel them. They're raised on the surface of the skin. And then our varicose veins are larger, greater than 4 millimeters in diameter, distended. They can appear very tortuous. We can visualize them on the surface of the skin. And in more complicated cases, the patients can experience stasis dermatitis and venous stasis ulcers within the Gator zone. And this area here is defined as the Gator zone. The Gator zone is in the medial and lateral malleolus and extends or ascends up towards mid-calf, just below the knee area. This entire area is the Gator zone, and the patients experience a lot of their symptoms in this area with the stasis dermatitis and the venous ulcers. Just to give an example of the different types of swelling, there can be several different types of swelling. This would be bilateral swelling related to congestive heart failure and even kidney failure. This type of swelling is related to lymphedema. And then this is the type of swelling that we typically see in our patients that are suffering from deep or superficial venous insufficiency. And this, what the veins look like, what our patients' legs can look like as they come to us for their ultrasound. This would be the spider veins that are very small and they're less than 1 millimeter in size. We don't feel these types of veins. We can see them, but we don't feel them. The reticular veins, again, they're between 1 and 4 millimeters in size, and we can feel them. They're raised on the surface of the skin, and the patient can feel them, and we can feel them as well. And then, of course, the varicose veins are the larger, dilated, gnarly type appearing veins that are very tortuous and uncomfortable for our patients. And this, again, in the area of the Gator zone, this is in the more severe cases of venous insufficiency, the stasis dermatitis, a tanning or brown discoloration of the skin, and then, of course, venous ulcers. Venous ulcers are forming, the fibrin is built up around the vessels of the skin, preventing proper gas exchange. The oxygen and nutrients cannot get to the tissue and support the tissue, therefore the tissue begins to break down. And this is a more severe form of venous insufficiency. It is estimated that 2.5 million people experience venous insufficiency, and approximately 20% will develop venous ulcers. The prognosis is poor for venous ulcers, and it definitely has a socioeconomic impact of venous ulceration. It's dramatic for our patients, for the lost productivity of their work hours. Many have to retire early because of this condition, and it also places a financial burden on our healthcare system, costing about $3 billion annually to manage and treat patients that have this venous insufficiency, severest form with venous ulcers.